All right, I'm going to do some hand hygiene. Hi, my name is Maddie. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Yep, Hannah Saeed, 12/5/96.
All right, let me confirm on your wristband. Okay, I'm going to provide privacy and comfort. I'm going to also provide safety throughout this whole head-to-toe assessment. On a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever experienced, what is your pain level today?
0.
Perfect. So now we're going to go on to general appearance. We're going to do the alert and oriented. So what is your name?
Hannah.
What is the date?
June 19th.
And then the location.
My house.
And then why are we here?
For head-to-toe assessment.
So she is alert and oriented times 4. I already did her height and weight to calculate her BMI and is within normal ranges. Her posture is erect and comfortable. There are no obvious physical deformities. Her facial expression is content. Her mood and affect is calm and cooperative. And then her patient hygiene status is clean and well-groomed. So on to skin and nails. And, yep. Her nails are pink. There's no clubbing. Her skin is warm, dry, and intact. There is no skin turgor above her clavicle, and her capillary refill is under 3 seconds, which is adequate. For her eyes, her conjunctiva is pink. Her cornea is clear and smooth. Her sclera is also white. Her irises are green, which is her eye color. Both of her eyes are symmetrical. And now we're going to do the perla. Her pupils are about a size 5. Dead. Okay, so she does have the perla response. So now we're going to do accommodation. So look at my pen and then look at the wall. She also shows accommodation. So now we're going to do the corneal reflex bilaterally. And she also displays her corneal reflex bilaterally. We're going to do the 6 cardinal field of gaze tests, which follow my finger. All right, so this shows that her cranial nerve 3, 4, and 6 are intact, and her perla was also a 5. Her peripheral vision, we're going to do now, so follow me, cover that eye. Wow, what number am I holding? 2, 3. All right, switch.
1, 2.
Perfect. So her peripheral vision is intact, and that is the cranial nerve 2. Her ears, moving on to that, they are symmetrical and they are bilateral. Her skin of her ears are intact. There is no discharge in or behind her ears. There are no masses or tenderness on her ears. And now we are going to do the whisper test, which does cranial nerve 8.
Thank God we are done with Mod 2.
Cranial nerve 8 is intact. Now we're moving on to the head, the face, and the nose. So her face is symmetric. I'm going to now feel her scalp. Feeling her scalp, there are no lesions, there are no patches, and she is normal cephalic. Now we're going to test cranial nerve 7. So can you raise your eyebrows for me? Can you smile? Beautiful. And then can you frown? And then out your cheeks. Beautiful. So cranial nerve 7 is intact. Now we're going to test the TMJ joint. Can you open up and close and protrude your jaw and retract? So the TMJ has no crepitus at all. So now we're going to do the sharp versus light touch. So Hannah, this is going to be sharp and this is going to be light. And this is testing cranial nerve 5. So I'm going to have you close your eyes, and I'm going to poke this on your face, and you're going to tell me whether it's sharp or light and where it's at.
Sharp left forehead. Or light right forehead. Soft or light left cheek. Hard or sharp right cheek.
All right. So there is her C in nerve 5 is intact. And now we're going to occlude her nerves to see if they are patent. Can you breathe in and out? Beautiful. Other side. Her nerves are patent. So now we're going to palpate her sinuses. All right. So the sinuses were they non-tender?
Non-tender.
Non-tender. So now we're moving on to the mouth and throat. So her lips are pink. They're smooth. There is no cracking going on. Her teeth open wide. They are white, and there is absolutely no decay in there. We're going to say ah real quick. Her buccal mucosa is also pink, just like her gums, and there is moisture and there's no lesions. Her gums are also not swollen at all, and there is no bleeding. Her tongue is also pink with no lesions. Now we are going to test cranial nerve 12. So can you stick your tongue out and move it? There we go. Cranial nerve 12 is intact. And now I'm going to have you say ah. Her uvula retracted, which is cranial nerve 9 and 10, which is also intact. So now moving on to the neck, we're going to palpate her lymph nodes. So we're going to do the pre-auricular, post-auricular, occipital, and submandibular. And those are all non-palpable. Were they tender at all?
Nope.
Also non-tender. So now we're going to feel for your carotid. Her carotid pulse was +2 bilaterally. And now we're going to assess her range of motion. So follow my lead. Can you touch both ears to your shoulder? Turn your head left and right, and turn it all the way up and all the way down. So her cranial nerve 11 is intact. Now we're going to test the range of motion of that. Go ahead and lift your shoulders up, push against my hand, and push against my hand. Full range of motion +5 for that. Moving on to the upper extremities, we're going to start by assessing your muscle strength. So go ahead and squeeze my fingers, push up, and push down. Beautiful. So that's +5 bilaterally for the arms and hand muscles. We're now going to move on to her radial pulse. Radial pulse is also +2 bilaterally, and while I was doing that, I was looking at her respirations, which were 15. My patient displayed no difficulty breathing or distress. While I am palpating, I'm going to look for any lumps or tenderness, which I feel or see none. Now I am going to listen to her anterior chest using the diaphragm in all 4 lobes. Deep breath in. Beautiful. So there was no adventitious breath sounds. Now we're going to move to the back. So starting at the chest posteriorly, we're going to look at the thorax and the scapula. Both of them look very symmetrical. We're going to now test symmetrical expansion by placing my hands right below her scapula. Take a deep breath in and out. Her chest expansion is equal bilaterally. Now we're going to observe her spinous processes. They seem to be in a straight line, and there are no masses or tenderness. Now we are going to percuss the kidneys. Did that hurt at all?
Nope.
So no tenderness with those, and now we're going to listen posteriorly. there was no adventitious breathing in that. So now we are going to go onto the heart. So I'm going to listen to all 5 regions on the chest, starting with the apex and working down to the base.
Should I lay down?
Sure. All right, with that, S1 and S2 are present. S3 and S4 are not present at all. So now I'm going to flip my stethoscope over to the bell and listen with that to see if there are any murmurs present. Again, going in those 4 or 5 same regions, starting at the apex and working down to the base. And there are no murmurs present. So now I'm going to see if I can feel her apical pulse, and then I will auscultate and see if I can hear it. And this is in the mid-clavicular line, 5th intercostal space. Her apical pulse is non-palpable, so now I'm going to auscultate and see if I can hear it. And her apical pulse has a regular rhythm, which is about 60. Moving on to her abdomen, just looking at it, her abdomen looks flat, it looks round, it is symmetric. There are no lesions or visible pulsations, Now I'm going to auscultate again in all 4 quadrants for vowel sounds, starting in the right lower quadrant. This is making so much noise. So the sounds there were normal active. So now I again am going to flip it to the bell side and I'm going to listen for brutes just above the belly button. All right, and there are no brutes present at all. So now I'm going to percuss and see if there's tympany in all 4 quadrants. And there is tympany present in all 4 quadrants. So now I'm going to do mild and deep palpitation to see if I can see any tenderness or enlarged organs in the abdomen. No tenderness in mild palpitation. Now we're going to deep. And there are no enlarged organs. Now moving on to the final section, her lower extremities. Her legs look symmetrical. There is absolutely no edema present. We're going to palpate her 2 pulses, starting with her dorsal pedis. 2 plus, 2 plus, and her posterior tibialis is also a 2 plus. Now we're just going to assess for muscle strength. So can you go ahead and push against my hands and then push down? So range of motion is a 5 bilaterally, and her pulsations for both were a 2 plus.